Good morning, everybody. It's a great pleasure to welcome you to this session on the ARIETTA 750. So I'm Jean-Michel Correas, and I'm working as an interventional radiologist in a university hospital in Paris. The main role of ultrasound is clearly to improve guidance. These start with the correct lesion identification and the study of the relationship of the lesion, of the tumor, with the vessel, the surrounding vessels, as well as with the surrounding organs like bowel. Of course, ultrasound is very helpful due to the real-time imaging properties to visualize the needle track and the tip of the biopsy needle or the electrode for treatment. With the fusion imaging, we're just opening a totally new era where we can, in a very fast way, combine the ultrasound information to the CT information, as well as combining all imaging ultrasound techniques like color Doppler, E-flow, or contrast-enhanced ultrasound for CT guidance. This was a 58-year-old man with a suspicion of a small renal mass incidentally discovered. As you can see, the renal tumor is not very well delineated but poorly vascularized as far as we can see with the color Doppler imaging. With contrast-enhanced ultrasound, the lesion is here, and at the very early phase of the enhancement, the lesion is not well delineated, but after waiting a few seconds, then we can start to see precisely the borders of the tumor. And this is, of course, mandatory for precise evaluation of the location of the lesion and precise placement of the electrodes. We decided to perform cryoablation of this lesion using fusion imaging. And we do think that this improved the reliability of the positioning of the electrodes on the cryoprobes, of course, and also make the examination much faster. This is the arrival of the cryoprobe. You see interposition of the pleura. You see that the lesion is not easy to access, and you can appreciate how well we can see the tip of the needle just going inside the lesion. At the end of the procedure, we can evaluate the ice ball with ultrasound, and you see this very strong artifact due to the ice inside the tissue and how well this is correlated with the placement of the tumor evaluated on the CT image. We perform all our ablation procedures under conscious sedation, so we should be relatively fast, otherwise the patient will not be able to stay in the same position for more than 1 hour, sometimes a little bit more. The combination of contrast-enhanced ultrasound and fusion imaging really improved the localization of the lesion and the placement of the electrode right inside the tumor to avoid unnecessary destruction of normal renal tissue, because you should remember that this will remain a minimally invasive therapy. The ARIETTA 750 offers premium imaging features, including excellent B-mode imaging with easy visualization of the needle tip, and we know that this is not an easy task. Good color Doppler and power Doppler imaging, including micro Doppler techniques, and contrast-enhanced ultrasound with fusion imaging and automatic registration. I would like to insist a little bit on this automatic fusion with the active patient tracker. Of course, the limitation is the placement of the tracker during the acquisition of the CT or the MRI image. However, it is very simple, it's fast, it's accurate, and it's automatic. I remember the beginning of fusion imaging with more than 1 hour spent with just the fusion procedure. Fusion imaging is playing a key role in interventional radiology. Now, I would say growing role, because it combined the real-time advantage of ultrasound imaging to the good spatial and broad view of CT. At the beginning, it was started with PET and CT and MRI fusion, but ultrasound is facing some additional challenges. In principle, we just superimpose the ultrasound information to the CT and MRI data to take advantage of both techniques. Basically, ultrasound provides the real-time imaging, and so we can really follow real-time the path of the needle of the electrodes, a good spatial resolution and mobility. But with the CT and MRI fusion, we can also get information about contrast with better contrast resolution and much broad overall evaluation of the lesion. The ARIETTA 750 is a very interesting system because basically the very high-end capabilities of systems have been included in the system, and this is including the good B-mode acquisition, color Doppler and microdoppler techniques, as well as contrast-enhanced ultrasound and fusion capabilities with active tracker.